Hi there, my name is Dr. Jeffrey Skinner, and today we are getting nosy about noses. We're going to talk about everything you need to know about the nose and nasal health and how to breathe properly through your nose because that is super, super important for us as humans. If we're not breathing through our nose, we're breathing through our mouth, and we are a lot more prone to having a collapse of the airway when we breathe through the mouth compared to when we breathe through the nose. And we also get 20% more oxygen on average when we breathe through the nose compared to breathing through the mouth. So I practice with Dr. Joseph Zelk in Portland, Oregon, and together we help patients look and feel younger. So he is a dual board certified sleep medicine provider and is interested in functional medicine and how to prevent aging and make patients healthy over the course of their life and their health span. So, without further ado, we'll dig in to the topic of the day, the nose. So, first, we're going to start about obstructive sleep apnea, OSA, and where most of that obstruction happens. So, 81% of it happens with the soft palate, and then almost half of cases, it deals with a tongue-based collapse, and then just under 40% deal with a collapse of the hypopharynx, the space right here below the tongue, like the epiglottis and all that stuff. That area collapses about 40% of the time. And as far as all of them combined, a multi-level collapse, when we have a collapse of two or more of these structures, that happens in about 2/3 of the patients out there. So it's something that is a problem for us. So the most common multi-level collapse is a combination of both the soft palate collapsing as well as the tongue-based collapsing, and that happens, in about 25% of the multi-level collapse cases. So, as far as nasal obstruction goes, it is affecting more than 20 million Americans every single year. So a lot of people have to deal with this problem, and you can just see this gal holding her nose, dealing with that pressure of the sinus and not being able to breathe. So how we deal with measuring the flow through that windpipe is pi times the radius to the fourth. So for example, if we go from like a 2-inch pipe to a 4-inch pipe, pi stays the same, so we're going to forget about that. So 2 to the fourth is 16. 4 to the fourth is 256. So there's exponentials, and then there's 2 to the fourth. So every little bit that airway gets obstructed, that's to the fourth change in the ability for air to flow through. So every little change is super important for better or worse. So one of the biggest problems that we run into with nasal breathing is that nose being plugged up. So this is a 3D x-ray of one of my patients. You can see over here we've got that lower turbinate, the inferior turbinate, just all kinds of puffy and angry. And then a couple weeks later, after working with a couple different sprays for nasal hygiene, just by cleaning that tissue off, it's so much happier and so much less inflamed. So one of the biggest takeaways that you can get from today is that just like how we're told that we need to brush our teeth and clean our mouth twice a day, we should also be cleaning our nose twice a day so that that tissue doesn't have a chance to puff up and get angry and close down. So that is something that we'll cover later on, but make sure to look out for it. That is the biggest thing that I want to impress on you today, is that we just need to keep that nose clean. So we're going to talk about the anatomy of the nose right now, and the things that we need to think about as we kind of go through this. So this right here is the outside of the nose. So this is what's called the nasal vestibule. This is the hole of the nose here, just right inside of it. And then the next part is going to be the inferior concha, and then it's named concha because it's kind of like a shell by the sea, like a conch shell. So we're able to use that extra bit of anatomy to warm the air, to moisturize the air, and to get it going in a smooth laminar flow, it's called, having a smooth flow of air. So here is the middle concha and the superior concha, and below them, this kind of passageway here is called the meatus. So, and then up here is the sphenoidal sinus, and then right back here in the very back of the throat here is the opening of the auditory canal called the eustachian tube. So with a lot of folks, you can get a feeling where you have water in your ear that just kind of goes, that doesn't go away. That's what happens when this tissue here gets inflamed and angry. Just like the floor of the nose and the sinus and stuff like that, this can get inflamed too. And when that gets inflamed, we can have some altered sensation and some problems there. So right here is the soft palate. Up here is the hard palate. This is the incisive canal where the nasopalatine nerve pops out, and that's what innervates the palate right here. Right behind your front teeth there, that little bit of gum there is there's like a little bump. That's where that nerve comes out. So resting tongue posture, we want that tongue right up on that incisive papilla, right on that little bump right behind the two front teeth. And lips together, teeth apart. And when you say the letter N, you put your tongue right where that little incisive papilla is. So we call that the N spot when your tongue is on that. So next, we're going to talk about what the nose looks like from outside. So this is what's called a nasal speculum. This little instrument here that kind of holds things open. And this is what we use to look inside the nose. So this is the septum, the middle part of the nose, and then the middle turbinate, and then the inferior turbinate. And down here is the floor of the nose, and this is called the ala of the nose, that bit of skin here. And the columella is the bit of skin in between the two different nostrils. So this is what the nose should look like. This is normal. So we don't have a lot of puffy, angry tissue. And then we've got moderate obstruction, severe obstruction, and then just totally obstructed. So how we kind of judge the subjective symptoms for the patients is a thing called the nose exam, the nasal obstruction severity exam. So the question here is, over the past month, how much of a problem were each of these for you? How much of a problem was nasal congestion or stuffiness for you? Was it not a problem, a mild problem, a moderate problem, fairly bad, or severe problem? So patients go through and answer each one, and then we add up their score and multiply it by 5. So that's the key down here, talking about just what we score these as. So next we're going to talk about the sites of nasal resistance. And first we're going to talk about the nasal valve. So that is the outside part of the nose that kind of sucks in, and that's where breathe-right strips help out. So this is me, and you can see my nasal valve collapse right here. So we did a thing called nasolaze, where we took a laser to tighten that skin and make sure that it's not as collapsible, and we'll be showing that later on. Next we're going to talk about the the septal swell bodies. So here's the septum. Here's that inner part of the nose right here. You can see that kind of pooches over, and that means that for some patients they can't breathe out one nostril, or that we've got increased resistance in one nostril versus the other. So for the most part, it's not as big of a deal as what people make it out to be. If you see here, the problem isn't really that we have this deviation here. The problem is that we've got all this puffy, angry tissue here in that lower, the inferior turbinate and the middle turbinate, as well as that part here called the septum. So as long as patients do nasal hygiene and really keep that tissue nice and clean, it's not going to puff up, and that septum isn't going to be as much of an issue. So there's a thing called the septal swell body, which is kind of further on down the nose, kind of towards the middle of the septum. So this area right here tends to swell up, and it's called the swell body. So here is the inferior turbinate, and then the middle turbinate, and then up here is the superior turbinate. So the whole point of these guys is for your body to be able to filter the air, so it grabs all the dust and all the particles and the bacteria and viruses out of the air, so that it doesn't go into your lungs, because your lungs are very delicate, and they're built to have things go across them into the bloodstream. So there's certain things that you just don't want getting into your bloodstream that easy, and that's the kind of the whole point of that turbinate, is to catch all those things, and it's a filter. And when that filter gets clogged, just like a Dyson vacuum, it says, hey, you need to clean out the filter, and stops working. So that's just what our body's telling us when these puff up. So through nasal hygiene, we're able to get them to shrink down. So along with the mucosal swelling of the turbinates, there's also a bony hypertrophy. So you can see how that bone has gotten a lot bigger here in that turbinate compared to the other side, and also compared to the middle turbinates up here. And then next we're going to talk about the floor of the nose, and you can see how this patient has a really puffy floor of the nose there. And the more puffy that is, or just the mucus laying there, that takes up space and prevents air from going through. So as we increase nasal resistance, that's when we start to grind our teeth more. That's when we start to have more clenching in the middle of the night, and that's when we have resistance to airflow, and that adds up and makes trouble over time. So the sinuses here, over here on the patient's right sinus, I know it's on the left side of the screen, but it's the right sinus because we talk about the side of the patient. So if we were the patient, this is going to be the right side. The left side over here is all filled up with all kinds of mucus and stuff like that. So when we have a blockage like that, that typically comes from the what's called the ostium. There's like a little hole up here that the nasal sinus is able to drain into the main nasal cavity through. And if that tissue here in the nose is really puffy, then it doesn't drain properly. And then it ends up draining when you go to lay down at night, and that's what we call a postnasal drip. And when we have all that congestion and we have that mucus there, that tends to act as a reservoir where bacteria can start to grow and create troubles and make that tissue puff up even more and close down even more. And then back there is the adenoid tonsil. And a lot of times this can puff up for kiddos and make it hard for them to breathe through their nose. When they talk about tonsil removal, they typically remove the lateral tonsils and then kind of in the mouth and the throat, and sometimes they remove the adenoids. So as far as nasal valve construction or nasal valve obstruction goes, a lot of the patients out there suffer from nasal valve collapse. So with patients who said that they had severe or extreme nasal airway obstruction based on their nose scores, 73% of those patients had a nasal valve collapse, 80% of them had a deviated septum, and 77% of them had turbinate hypertrophy. So these are the things that we need to work on and figure out how to deal with. So as I said before, the septal deviation isn't really the issue here. It's that both the turbinate hypertrophy, which that air needs to speed up in order to go through. When that air speeds up, then the pressure drops, and when the pressure drops, it sucks that ala of the nose in. That's what creates that nasal valve collapse. So by cleaning the nose out, that tissue is not as puffed up and it's not as restricted, and we end up having a much better breathing experience. So, as far as the types of nasal resistance out there, we've got variable obstructions, which tend to be the soft tissue obstructions. For that, we're talking about nasal valve collapse, just swollen mucosa, the inside of the nose being swollen, like the floor of the nose and the walls of the nose, things like that being swollen. Congestion, having that mucus build up in there, as well as the hypertrophic adenoids. Big adenoid tonsils can contribute to nasal resistance, and also polyps. So polyps of the nose are very different than polyps of the GI tract. Polyps of the nose are associated with a lot of inflammation up there. They're not going to turn into any kind of precancerous lesions or anything like that typically, unlike polyps that you find in the GI tract. So next we're going to talk about the fixed obstructions, which tend to be the hard tissue kind of obstructions that create resistance. So deviated septums and the bony hypertrophy of turbinates, and different anatomical abnormalities. If people get hit in the face and break their facial bones, sometimes that can make the airway smaller. Things like that. Or if they get hit in the nose, and that septum changes position because of that, it can be an issue. So nasal congestion can either be due to infection or some sort of allergic-based inflammation that significantly blocks that airway function. So congestion can be resolved either by doing the nasal unblocking technique or doing proper nasal hygiene, or you can also do pharmaceutical means, things like Afrin or Mucinex, things like that. So it's a lot easier thing to handle than what people think. You don't need to suffer through that and have terrible night's sleep. And if you've got a bad night's sleep, then you're also not going to have as good of an immune system to fight off that infection. So it's not cool or manly to tough it through. It's just not smart to tough things through. Why struggle, and why prolong that illness longer than you have to? Take some meds and make your life easier and get over that thing quicker. That way you don't pass things on to your family. You don't pass things on to people that you work with. You got to be kind to yourself and kind to others. So just something to kind of think about with that. So nasal polyps are teardrop-shaped growths in the sinuses and also in the main cavity of the nose. They're typically painless and benign, and they can also develop in clusters like grapes. They're typically caused by inflammation, allergies, as well as recurring sinus infections and asthma. And there's also been some evidence that folks that take Tylenol more than most people that take, Tylenol like small doses every day, tend to have a lot more polyps. They can lead to difficulty breathing. They can lead to postnasal drip. They can have you have a runny nose. They can lead to the loss of smell and taste. They contribute to more frequent infections because these globs, they're harder to clean out. So when we have areas that are harder to clean, bacteria tend to stick there and can create trouble. So it also can contribute to facial pain. So when these swollen areas inside of your face are really swollen, that's no fun. Think about if you hurt your knee and your knee swells up like a basketball. It's painful. When we have the areas inside of your face that swell up, it's kind of harder and more nondescript. It's harder to really feel and describe and understand that that's the problem. But these polyps can definitely contribute to facial pain. As far as treating them, doing a really good job with irrigation and nasal hygiene, that can help out. steam inhalation, using like a nebulizer. And then also sometimes you can use that nebulizer to bring in medications. So corticosteroids uh, like Flonase can be helpful, and Nasonex. Antihistamines, decongestants like Afrin can be helpful, and antibiotics can be helpful if there's an infection. Or there's also a surgical option where they can use a laser and just kind of laser them inside the nose, and that's pretty easy to bounce back from. There's not really much going on with that, so pretty easy surgery. Uh, Nasal cycling is that describes when each nostril alternates contraction and expansion every hour and a half to 3 hours or so. So this happens in about 80% of the population, and the cycling in the nose makes sure that at least one side of the nose is always moist to humidify that air, and it's created by selective autonomic activation by the hypothalamus. So your brain tells the parasympathetic nervous system to puff up one side and then the other, then the other, then the other, going back and forth. As far as the nose and obstructive sleep apnea go, variable nasal obstruction is much more important in the creation of obstructive sleep apnea compared to fixed obstructions. Nasal cycling plays a large role in creating that nasal resistance, and there's also a big difference between nasal breathing and mouth breathing. When you breathe through your nose, there's a reflex that gets that tongue up and out of the airway, and also tells those dilator muscles of the throat to open up. Whereas mouth breathing, you don't have any of that. So, that airway is just kind of floppy. And there's studies that have come out that said that when you breathe through your mouth, you've got 250% higher risk of having a suffocation event. And then when they use topical lidocaine and spray that in the nose and turn off those receptors, the airway gets significantly worse. So those receptors in the turbinates are super important to use that reflex to hold that throat open and tell those muscles to hold open while we're asleep, because when we're in deep and REM sleep, our entire body goes limp. We lose all muscle tone with the exception of breathing muscles. So when we breathe through our nose, that stimulates in the parasympathetic nervous system compared to chest breathing, like through your mouth. That creates a sympathetic pattern. So they say that chest breathing is stressed breathing. So when you breathe with your diaphragm, you pull that air deeply into your lungs and give it a lot more time to pass over into the bloodstream. And when we breathe with that diaphragm, we're also pumping that lymphatic drainage system. So it's super important that we use that diaphragm when we breathe. So they did a study where they plugged up the nose intentionally and found that there is a much higher risk of sleep-related breathing disorders in healthy patients when they plugged up the nose compared to when they just let them sleep normally. Then there's a thing called AHI, which is when a patient suffocates for 10 seconds or longer, which is kind of the standard metric in sleep apnea, even though as clinicians we don't really use it anymore, but in certain insurance applications, that's what they still use, which is wild to me. The guy that invented AHI was also the same guy that discovered REM, like REM sleep, at the Stanford Sleep Clinic, and he said that was the biggest mistake of his life, coming up with AHI, because he was just looking for a way to talk about just severity of suffocations, and he just kind of threw that out there. 10 suffocate if you suffocate for 10 seconds or longer. There's not really much difference if you suffocate for 8 seconds versus 10 seconds as far as the body's concerned. So it's just something that we don't use. But That metric was increased significantly when the nose was packed after nasal septum surgery compared to non obstructive sleep apnea patients. So the nose plays a huge role in breathing and our ability to breathe while we sleep. So the increase in sleep disordered breathing severity changes with the level of nasal resistance in folks with seasonal rhinitis or inflammation in the nose. So the microarousals that were associated with sleep disordered breathing are more frequent in subjects with seasonal rhinitis or seasonal allergies compared to the controls. And there's also a significantly higher prevalence of allergic rhinitis in sleep disorder breathing patients compared to patients with chronic obstructive pulmonary disease. So, there's a huge relationship between the reversible nasal obstruction and sleep disordered breathing. So, as far as the evidence for nasal surgery, one of the studies had 160 patients that underwent nose job, and 88, had a primary rhinoplasty as their first go around, and 72 had a secondary. It was their second go around trying to get a nose job. So, patients without turbinate hypertrophy or septal perforation were used for this. So they're just looking at the external valve alone. And they did a valve reconstruction, and that increased the airflow by 2.6 times, which is a lot more flow through the nose. So they also did internal valve reconstruction alone by tissue grafting, and that increased nasal airflow by 2 times. And the largest improvement was seen in patients that had a septal deviation and a nasal valve collapse. So they increased their nasal airflow by fixing that nasal valve collapse and fixing the septum. They're able to increase flow almost 5 times, which is so much air. So septal and valve surgery lowered nasal resistance in 90% of the cases that were tested, and septoplasty alone didn't really improve nasal flow. Correction of the valve obstruction alone increased nasal flow. So patients that had both nasal valve collapse and septal deviation had the greatest postoperative improvements. And there's also a significant improvement in sleep suffocations after the nasal valve obstruction or the nasal obstruction was relieved for patients with mild obstructive sleep apnea that had normal head metrics, a thing called cephalometry, where we, just kind of make measurements of the patient's skull and make sure that things are, within bounds of normal. So within normal patients with mild obstructive sleep apnea, they had a good amount of relief of nasal obstruction and had a lot of improvement. So there's a thing called Latera, which is a resorbable nasal implant that's placed by ENTs to prevent nasal valve collapse. It's essentially just a really, really thick rod of suture material that resorbs into the nose over time and turns into collagen. So it's got a high level of success, high reimbursement rate with insurance companies. It's a very quick procedure and really painless. They just kind of numb up the nose a little bit and then place that little rod in there and let you heal up. So pretty easy, and it prevents that nose from collapsing down. So there's a randomized clinical trial of septoplasty versus a sham surgery in patients with obstructive sleep apnea, which imagine going through a surgery, and having to deal with the pain and the nasal packing and not even have, your septum fixed. So that study found that there was a 15% success rate with oral breathing preoperatively, and they changed to nasal breathing. So 15% of patients just automatically switched. So next, I'd like to chat about head posture. So the the um, the angle here between the neck and the head change spontaneously with palatal expansion and opening of the nose with kids, um, which is awesome. So a lot of people tend to have forward head posture with bad airways in order to help keep that airway open. And a lot of times that also means a posterior tongue tie. So them having a more upright posture means that airway improved, and that happened spontaneously for most of the people in the study. So the number one and number two place where that airway collapses is the soft palate and base of the tongue. Nasal receptors keep that airway open and keep that tongue forward. So expansion, meaning both palatal expansion as well as dentoalveolar expansion, just tipping the teeth out and making more space for that tongue, makes breathing easier because the nasal breathing gets better that we've seen in studies. So when you make space for that tongue to come forward, it does come forward. And when you open up the nose with a expander, for every millimeter of expansion that we get about 4% more air, which that 4% may not sound like a lot, but it is a tremendous amount because we start talking about that to the fourth thing. So, that's exponentially more air. So next we're going to chat about the pharmacology of the nose and the importance of nasal hygiene. So Dr. Zelk, who I work with, who is really good with functional medicine and just holistic care of folks, says that upper respiratory disease is common, but it's not normal. There's so many people out there that just take kids having runny noses and being sick for granted, and it's just so common that people think that it's normal. It's just normal for kids to have upper airway issues, but it's not normal. It's just common, and how we fix that and how we prevent that is just simple nasal hygiene. So for my personal nasal hygiene protocol that I learned from Joe, we essentially just we start off by using clear. So when I go to brush my teeth in the morning and when I go to brush my teeth at night, this is what we do. I start putting the clear in my nose and start brushing my teeth. And I brush my teeth for 2 minutes while that clear kind of soaks in and lifts some of the schmutz and allows me to get it out. So that clear breaks up the biofilm of the nose. It's got xylitol in it, which is a fake sugar, and that fake sugar inactivates viruses, as well as when bacteria eat that, they pop. So it also moisturizes the nasal tissue. Just using saline alone, it's not as good. Saline kind of dries out the tissue, but this has a little bit of grapeseed oil in it, so that ends up moisturizing that tissue. And it also helps us kind of dissolve some of the bacteria and the pollen and dander and stuff like that and get it out. So you do 2 pumps up each nostril, and then after you let it soak in while you brush your teeth, you just kind of hold one nostril and blow, and then you hold the other nostril and blow your nose. By holding one side shut, that allows you to build up more pressure to really get everything out that you need to get out. By using clear and cleaning off that tissue, it's going to make the other sprays that you use a lot more user-friendly and make them a lot more effective because they're actually touching that tissue and interacting with that tissue and doing what it needs to do. So when it's in pollen season, I also tell my patients to use clear as soon as they get home from work or as soon as kids get home from school. Number one, it takes a while for that bacteria to get through that tissue and into the body. So by cleaning things off quicker, your body has less chance to puff up and respond to that insult, from the pollen and dander. But you also get a chance to kind of kill the bacteria before it has a chance to get into your bloodstream. So one of the things that's just super important. So the second part of our nasal hygiene protocol, after we use that clear, we use hypochlorous acid, which is what your immune system uses to kill bacteria and viruses. And it's also a natural anti-inflammatory. When it's outside the cells of the immune system, it says, hey, you can turn off the alarm. The cops are already here. You can crank down the inflammation because the cells that you're trying to recruit here to deal with that allergic reaction, they're already here. So, quit being so puffy. So we use Hyponasal typically. That is the brand that you can find on Amazon and is really helpful. It's the most pure form out there. Other hypochlorous outfits just aren't as pure of a chemistry, and sometimes can lead to burning inside the nose. So sometimes it can burn, but using clear first, will really help that. So by using the clear to clean off the tissue and having this actually touch the tissue and shrink it down, we're able to progressively over time shrink all of the tissue inside of the nose and keep killing the bacteria and viruses that make us sick. So just by cleaning out our nose with clear and hyponasal, we're able to get rid of a lot of the problems that we deal with as far as strep throat and those puffy tissues that don't allow us to breathe properly. Next, I'd like to talk about Afrin. Afrin kind of gets a bad name in our society. A lot of people say that it's addictive, which it's not. But the problems with Afrin come from people not using it properly. So oxymetazoline is the active ingredient in Afrin. That's what really forces that tissue to shrink down by constricting the blood vessels. So it can provide relief really quick. And you also shouldn't use it for more than 3 days in a row, because if you do, you get this thing called a rebound, where that nose puffs up even worse than it was before. So how I tell my patients to use it, like the patients that come in where you can just like hear them breathing, and you're just like, oh buddy, I can hear you breathing from across the room, you poor person. That's when we start using Afrin in the nasal hygiene protocol. So first we use the clear to clean that tissue off. Then we use that Afrin to really shrink that tissue down, and then we use clear again to get all the schmutz off the tissue. Because when that nose gets inflamed, that tissue puffs up and creates these crypts where bacteria and pollen and dander can hide and not really be cleaned out. So by shrinking that tissue down, we make it a lot easier to get that stuff out. Where people go wrong with using Afrin is, yeah, they use Afrin and shrink that tissue down, but they don't do anything about that tissue and the reason why it was puffing up in the first place. So after that Afrin is done working, because they haven't done anything to clean their nose out, that tissue puffs right back up to where it was. So, they end up getting relief, and then the relief goes away, then they use it again, then again. That's where that misnomer comes from, of having a addictiveness to it, is that people get addicted to the ability to breathe. They don't actually get addicted to the oxymetazoline. So if you use it right, it can be a great tool. And I tell my patients after they use it for a few days and really shrink that tissue down and get the ball rolling on the nasal hygiene, keep it in your cabinet and use it as like a break glass in case of emergencies kind of deal. Where if you go over to somebody's house and they've got a cat and you're allergic to cats and your nose just, fills up with tissue, and you can't breathe, when you go to sleep, like that's when I use this. In those situations where that nose just puffs up due to some sort of allergic reaction, so that you can get things under control with your nasal hygiene after that. So other examples of this oxymetazoline are Mucinex, Sinus Max, Sudafed, Sinus Severe Original nasal spray, the Vicks Sinex nasal spray, and also most importantly, that Clear Rescue. So the normal Clear is in a blue bottle. Clear Rescue is in a green bottle. So some folks kill two birds with one stone, and instead of using Afrin, they use the Clear Rescue because it has the same active ingredient. It doesn't really matter to me what you use. But if you get the green bottle, you still have that issue where you just can't use it 3 days in a row, otherwise you get rebound. So, something to think about. Next, I'd like to talk about Flonase or fluticasone. So that's a corticosteroid. It's specifically a glucocorticoid, and it reduces the inflammation of the nose by calming down the immune system and stopping the cells from releasing substances that cause inflammation. Different cytokines. So it blocks the release of those inflammatory molecules that cause the allergic reactions, but it also narrows the blood vessels, so it acts kind of like oxymetazoline, but not to as much of a level as Afrin. It can be used to treat stuffy and runny noses, itching, sneezing, nasal polyps, non-allergic rhinitis or inflammation of the nose, chronic nasosinusitis, and can also be used to control asthma. All asthma means is that you just have a small airway, and when that airway gets even more angry, it closes off almost entirely. So by making that tissue less inflamed, we're able to control asthma a lot better. So it can take several days or even weeks to feel the full benefits of fluticasone. I end up using fluticasone, Flonase, in cases where you are allergic to cats and you live with a cat, or you're allergic to dogs and you live with a dog, or you're allergic to cottonwood trees and you got a cottonwood tree right outside your house or right outside of your job. So if you're constantly in a allergic state, Flonase is just essentially it's meant to prevent that tissue from puffing up as much. We still need nasal hygiene to clean all that stuff off the tissue. Flonase is not a replacement for nasal hygiene. None of these are a replacement for nasal hygiene. We still need to clean that nasal tissue to prevent it from puffing up. But Flonase is a helpful thing, and you can use Flonase every single day. You shouldn't stop using fluticasone suddenly, especially if you are transitioning from oral steroids like prednisone or things like that. So how this works is the early phase reaction gets stopped. So as does the late phase reaction. The recruitment of the inflammatory cells and secretion of different mediators gets stopped. It's fluticasone or Flonase, stops that mast cell from releasing all that stuff. So it stops the histamines, cytokines, leukotrienes, prostaglandins, tryptases, and chemokines from being released. So that is something that can really help folks that are dealing with seasonal allergies. Or even just like allergies of living at home. So instead of just doing medication to get through some of this stuff, I also recommend to my patients to get an air scrubber where you use ozone to charge the air and make viruses fall out of the air. I also recommend that people use duct cleaning services to clean out their air vents, and just have a clean, tidy lifestyle. Try to keep things clean and prevent that tissue from puffing up. So next, I'm going to chat about Nasacort, which is a triamcinolone acetonide spray. It's a corticosteroid, very similar to the Flonase that we just talked about. It's very, very similar. And it takes a while for it to kick in, and it can take up to 2 to 3 weeks for the full effect to be achieved. And we've got common side effects that include nosebleeds, headache, sore throat, coughing, sneezing, burning, and septal perforation, nasal irritation, vision problems, and can make infections worse. So Flonase, there's also an issue with severe allergy and reduced adrenal function. You can get Cushing's syndrome, which is essentially just a response to all these steroids. You can have skin reactions, you can have vision problems, and there's also issues with blood sugar. So folks that are on diabetes shouldn't be taking corticosteroids like Flonase or Nasacort or Nasonex. Nasonex is another corticosteroid that works just like Flonase or fluticasone, and it takes a while for it to kick in. Same issues. Astapro, another name for the generic of that is estelazine, and that's a steroid-free antihistamine that targets and blocks histamine receptors of the nasal passages, and it's used to relieve nasal allergy symptoms. And it works by blocking that histamine, the chemical that causes allergy symptoms like sneezing, runny nose, and nasal congestion. According to the company, it can work as little as 30 minutes. In my personal experience, it takes longer than that. Typically, it's like an hour, hour and a half, and it does work. It does. But my goal here isn't necessarily to just throw medications on this. It's just simply to clean the nose out with that clear, which is essentially just saline with some xylitol and some grapeseed oil, and then the hypochlorous acid, which is something that your body already makes. Your immune system already makes that, along with some purified, distilled water. So those things are really natural, and there's not really a lot of use in my clinic for these things, unless my patients are living a life where they just can't escape, having these histamine releases. So Claritin is a steroid-free, over-the-counter, second-generation, non-drowsy oral antihistamine that blocks histamine receptors. And you can use that to relieve nasal allergy symptoms as well as other allergies as well. Although they say that it's non-drowsy, it's still drowsy. Not as bad as Benadryl and the first generation meds out there, but it still is, it still affects people as far as being drowsy. So it increases your risk of dry mouth and headaches, and serious side effects are rare. The dosage for this is 10 milligrams, so there's not a lot floating around. Next is probably my favorite, Zyrtec. It's another oral, over-the-counter, second-generation histamine H1 antagonist that blocks histamine receptors. Once again, it's still drowsy, still causes headache, still causes dry, sore throat, still can cause nausea or fatigue or diarrhea. But it's a good oral option, and if you know that you're going to be outside in the field going on a hike, something like that, it's good to pop a Zyrtec and prevent any issues, prevent that nose from puffing up until you can get home and do your nasal hygiene to get all that schmutz off the tissue and prevent it from puffing up. Allegra, same kind of thing, second generation oral antihistamine. That you can use. For this one, it's 180 milligrams, so a lot more that you have to take for this guy. But it all comes back to nasal hygiene. Just cleaning that nose out every single day means that we get the bacteria and virus out of there, and we get that tissue shrink down so you can actually breathe. And you just have a much better life. And I just don't understand why ENTs don't really talk about nasal hygiene. All they do is just kind of throw some of these medications at folks. The only thing that I could really think of is, they charge a lot for nasal surgeries, and the just throwing steroids at something, the puffiness is going to come back. The medical insurances force patients to undergo use of nasal steroids before they'll agree to allow nasal surgeries to happen. So, if you are using the nasal steroids just like the medical insurance says you should, but you're not doing the nasal hygiene, that means that tissue is going to puff back up, and you're going to be doing, a surgery that you billed in medical insurance. Whereas if you use those steroids, then you do nasal hygiene, a lot of the symptoms that patients have, like, it's going to go away. So, please, please, please do nasal hygiene. I don't want to harp on my patients, just like how we have to harp on them for doing flossing and things like that, or even just standard brushing twice a day. Um, Nasal hygiene should be a part of your life, and nasal hygiene is something that will improve your life greatly. And I can understand why some patients don't floss, because when you floss on gums that are already puffy and inflamed, yeah, sometimes that can hurt. But there is no pain to doing nasal hygiene. So, please, do nasal hygiene yourself. Encourage your kids to do nasal hygiene, because while you're growing, if you breathe through your mouth, there is restricted growth of the top jaw. So when there's restricted growth of the top jaw, that means that the inside of the nose doesn't grow as well. And also your face becomes deformed if you breathe through your mouth. So, please, make sure that the kids of your life are doing nasal hygiene as well. Because when we breathe through our nose, we're able to pick up nitric oxide that's made in the sinus. So it's about 2,000 parts per billion compared to 180 parts per billion in just the nasal cavity. And outside air is 10 parts per billion. So nitric oxide is the active ingredient in Viagra, and it tells blood vessels to open up. So when you breathe through your nose, you're able to pick that up, and it tells the blood vessels of the lungs to open up. More blood flow through the lungs means more opportunity to pick up oxygen. And when we have that tissue that is puffy and closed off, we're not getting all of that nitric oxide to make our blood vessels happy. So, there's cardiovascular concerns of having a stuffy nose, which is crazy. But here we are with the data to support it. So, with the increase in nasal resistance, folks with obstructive sleep apnea have a much worse disease and a much worse time. And that collapse that happens with these obstructive sleep apnea patients happens because of increase in nasal resistance. So the dilator muscles of the throat in obstructive sleep apnea patients contract with more force when they're awake because of that deficient anatomy, but they contract with less force while they're asleep. So, that tells us that in order for us to breathe properly while we're asleep, we really have to focus on having a airway with minimal resistance. This is a thing called the Starling resistor model, which essentially talks about the nose over here being, rigid, and then the tissue back here in the throat is, floppy, so it can suck in, and then the trachea has it's considered a rigid structure because of that cartilage. So here is a video that kind of shows what happens. So right here's that pharynx, here's that rigid part of the nose, here's the pharynx. This is a 3D printed version of our nasal airway. So notice that when the left nostril is closed with a finger, that increases resistance, then this airway shuts off. So what that tells you is that by having increased resistance there, that air needs to speed up, and that sucks that area in the back of the throat closed. So by having a better airway, we are able to have a much better life and get more oxygen through the airway and into the lungs and throughout your body. So in conclusion, variable nasal obstructions, that soft tissue mucosal swelling is much more significant of an issue to obstructive sleep apnea than fixed obstructions like a septal deviation. Those fixed nasal obstructions lead to more long-term conversion to mouth breathing, and the intermittent periods of low nasal airflow can create a closer link to nasal breathing with autonomics. So palatal expansion also increases the nasal volume and decreases nasal resistance. So that drastically changes those suffocations that we have in the night. So by creating more space there in the nose, we're able to decrease that resistance and have a much better airway. Thank you so much for attending my talk and learning about the nose. If you have any questions, please feel free to reach out. I practice here in Portland and maintain a group called the Air Institute, which is a study club of over 1,000 dentists and sleep physicians in the U.S. And we also have some folks abroad. If you want to look for a airway-friendly dentist, that's where to find us, is the Air Institute. We also have videos like this that patients can watch and learn and learn how to be well. So thank you so much, and I hope you have a terrific rest of your day.